type 1 diabetes, or LADA. Between 1985 and 2013, when my father passed away, he injected insulin 4 times a day. My father's misdiagnosis and re-diagnosis would not have happened 100 years earlier for the simple reason that no one at the time thought of diabetes as consisting of different types of diseases. To be sure, physicians, health journalists, diabetes patients, and family members were all aware that age greatly influenced the progression of the disease. In the days before insulin, diabetes advanced rapidly among the young, leading to significant weight loss, ketoacidosis, and death within a few short years. For those who were middle-aged or elderly, the body's deterioration took place at a slower pace, making it possible to live for several years, although often with significant health problems. People referred to these two forms as acute versus chronic, or severe versus mild, but they did not think of them as differing physiologically and pathologically. The discovery of insulin in 1921 to 1922 minimized the differences between the two forms because those whose bodies did not produce insulin could now inject a hormone that ameliorated the most severe aspects of the acute form. Still, by mid-century, there was a growing sentiment that the two types were different enough in their age of onset, seriousness of symptoms, and degree of fatness to warrant a sharper distinction, and the terms juvenile diabetes and adult-onset diabetes came into more frequent use. By 1979, diabetes specialists considered such differences important enough that they officially divided diabetes into what they called insulin-dependent diabetes mellitus, IDDM, and non-insulin-dependent diabetes mellitus, NIDDM. By 1995, these two were known as Type 1 and Type 2. Today, as I write, there is considerable discussion about whether this classification continues to make sense. The medical community actually recognizes more than two types of diabetes. After types 1 and 2, the third most common form is gestational diabetes, in which diabetic symptoms appear during pregnancy and then usually abate after birth, leaving mothers at risk of developing type 2 diabetes later in life. There are also less common forms, including maturity-onset diabetes of the young, MODY, neonatal diabetes mellitus, NDM, and latent autoimmune diabetes of adulthood, LADA. What they all have in common is high blood sugar, but beyond that they are considered to be quite different. For example, type 2, which affects roughly 90% of all people with diabetes in the United States and in the world, is believed to develop when the body's tissues become insensitive or resistant to insulin. Type 1, in contrast, appears to be an autoimmune disease that develops when the body attacks the insulin-producing beta cells of the pancreas, thereby destroying the body's ability to produce any insulin. Research conducted in the last several years, however, suggests that it may be misleading to draw a sharp line between insulin resistance and beta cell dysfunction, and that it may make more sense, both scientifically and clinically, to think of diabetes as a spectrum of disorders, with various degrees of insulin resistance and beta cell dysfunction. In other words, the proliferation of diabetes types in the medical literature since 1979 may stem from the medical community's continued struggle to understand what causes sugar to build up in the bloodstream. The belief in the past that something united all the different forms of diabetes may not have been totally wrong. When I began working on this book, I thought that I would be writing the first history of type 2 diabetes. I intended to complement what we knew from several excellent studies of the history of diabetes, some of which had focused on insulin's discovery and the startling stories, following the hormone's distribution, of individuals literally rising from their deathbeds and of parents rejoicing that they would not have to bury their children. I was especially inspired by the work of the physician-historian Chris Feutner, who had turned his attention to the challenges that insulin-dependent diabetes patients faced after the initial excitement of the path-breaking treatment wore off and complications associated with the disease began to emerge. He showed how those dependent on insulin learned quickly that the hormone was not a cure, but rather a tool for helping them manage their disease.